Balance and functional mobility preservation become critically important after age 60, particularly for maintaining independence and preventing falls. Today we're covering 4 fundamental movements practiced daily in Japanese senior communities: one-leg stand for neurological balance, heel-to-toe walk for gait coordination, half squat for lower body strength, and ankle rotations for joint stability. These movements target proprioception enhancement, cerebellar pathway activation, functional leg power, and ankle mobility restoration. When practiced correctly and consistently, they help maintain balance confidence, prevent falls, preserve walking ability, and support continued independence. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have recent joint replacements, severe arthritis, balance disorders, neurological conditions, or history of falls. Understanding balance as neurological function after 60. Balance represents complex neurological function involving brain, inner ear, vision, muscles, and joints working in coordination. After age 60, this integrated system gradually declines without targeted practice, manifesting as increased fall risk, reduced walking confidence, and decreased functional independence. Research demonstrates that balance ability directly correlates with brain health, with studies showing adults struggling to stand on one leg for 20 seconds face higher risks of small strokes and reduced cognitive function. This connection occurs because balance requires constant communication between proprioceptive system, vestibular system, visual input, and motor control centers in brain. In Japanese wellness philosophy, these movements represent maintenance exercises, practiced not for athletic performance but for preserving freedom to move, walk, and maintain self-care with grace throughout aging process. These 4 exercises strengthen not just muscles but neurological pathways supporting coordination, spatial awareness, and rapid balance recovery when stability is challenged. Exercise 1, one-leg stand for proprioceptive training. One-leg stand represents simple yet powerful assessment and training tool for balance and brain function. Research published in Stroke Journal found adults over 60 struggling to balance on one leg for 20 seconds showed significantly higher risks of silent strokes and reduced cognitive capacity. This connection exists because standing on one leg activates proprioceptive system, the body's spatial awareness mechanism, forcing brain and core stabilizing muscles to work together harmoniously. In Japanese senior centers, this practice called sustained balance helps elderly maintain light walking ability and mental clarity into their 90s. This movement preserves not just physical stability but dignity and independence, 2 qualities essential for quality of life in later years. Balance, like memory, fades without regular training, making daily practice essential for maintaining neurological pathways supporting coordination and fall prevention. Stand near sturdy chair or countertop for safety. Gently lift one foot off floor approximately 3 to 6 inches. Hold position 10 to 30 seconds, only as long as feeling safe and controlled. Keep gaze forward, spine straight, using fingertips lightly on support if needed for balance. Slowly lower foot and switch sides. Repeat 2 to 3 times per leg, once or twice daily. Start with just 5 seconds if unsteady, gradually building duration over weeks. Focus on progress rather than perfection. Over time, this simple movement improves posture, strengthens ankles and knees, and reactivates coordination pathways in brain. For added challenge when safe, try closing eyes briefly or performing while brushing teeth. Within 2 weeks, many people notice improved stability on stairs, curbs, and slippery surfaces without consciously realizing training effects. Exercise 2, heel-to-toe walk for cerebellar activation. Heel-to-toe walking trains cerebellum, the brain region responsible for balance, coordination, and fine motor control. Research in Frontiers in Aging Neuroscience demonstrates that balance-focused walking strengthens neural pathways, improves gait symmetry, and reduces fear of falling, one of the largest psychological barriers to healthy aging. When foot moves heel to toe in straight line, body makes constant micro-adjustments in real time, activating core, gluteal muscles, ankles, and deep stabilizers. This process functions like recalibrating body's internal positioning system. In Japanese wellness programs, this represents graceful movement practice, explaining how many Japanese seniors maintain effortless walking ability into their 90s. This movement affects not just physical walking mechanics but psychological confidence and sense of control during movement. Find clear straight path approximately 6 to 10 feet long. Stand tall with arms extended slightly outward for balance. Place right heel directly in front of left foot toes, forming straight line. Take 5 to 10 slow steps, heel touching toe each time, moving deliberately while focusing on control and balance. Hover one hand near wall or chair if needed for security. Upon reaching end, turn around and walk back. Repeat this path 2 to 3 times daily. This exercise strengthens small stabilizer muscles in hips, legs, and feet, muscles preventing falls when stepping on uneven surfaces. With consistent practice, walking on gravel, stairs, or wet pavement becomes less intimidating. This represents balance training for real-world situations, not just exercise for its own sake. Exercise 3, half squat for functional leg strength. Ability to lower and lift body using leg strength directly correlates with functional independence, particularly after age 70. Research in Journal of Aging and Physical Activity shows leg strength, especially in quadriceps and gluteal muscles, strongly predicts mobility, fall prevention capability, and hospital recovery times in older adults. Squatting movements activate joints, improve circulation in hips and knees, and preserve range of motion gradually lost with aging. However, traditional deep squats can stress aging knees, making half squat the preferred joint-friendly alternative offering similar benefits with reduced strain. In Japanese senior centers, half squats form part of daily routines, often paired with breathing exercises connecting movement with mindfulness. Each repetition represents a quiet act of resilience, reinforcing self-reliance and functional capacity. Stand with feet shoulder-width apart, spine upright, arms extended forward for balance. Slowly bend knees as if lowering onto invisible chair, stopping at comfortable point roughly halfway to sitting position. Hold 1 to 2 seconds, then push through heels returning to standing. Perform 8 to 10 repetitions, resting as needed between reps, ensure knees stay behind toes and weight remains in heels rather than forefoot. Place sturdy chair behind you if uncertain about balance for safety. This movement strengthens thighs, hips, and gluteal muscles, key muscle groups for standing, walking, rising from chairs, and getting out of bed. Practiced consistently, this improves circulation to lower joints, reduces stiffness, and builds power needed for daily functional activities through controlled, purposeful movement. Exercise 4, ankle rotations for joint mobility and reflex preservation. Ankles represent first line of defense against sudden balance challenges like stepping off curbs or recovering from stumbles. Research in Gait and Posture Journal found reduced ankle mobility and strength closely correlate with fall risk and decreased walking speed in older adults. Ankle rotations lubricate joint, improve circulation, and reawaken stabilizer muscles supporting quick movements on uneven surfaces. In Japanese wellness culture, this movement builds foundational resilience rather than serving as simple stretching, training reflexes potentially preventing falls, fractures, and extended recovery periods. This quiet, almost invisible movement strengthens protective mechanisms essential for maintaining independence and avoiding injury. Sit comfortably in chair with spine upright. Slowly lift right foot off ground few inches. Begin rotating ankle clockwise in slow controlled circles for 10 rotations. Reverse direction, rotating counterclockwise also for 10 rotations. Focus on making full smooth circles with foot, not entire leg, keeping these steady and allowing movement to originate from ankle joint specifically. Repeat with left foot. Perform 2 to 3 rounds per side, once or twice daily. If performing standing, hold chair or counter for support while rotating one ankle at a time. This movement enhances ankle flexibility, strengthens joint structures, and helps prevent missteps or twisting injuries, especially on uneven ground. Over time, you'll notice quicker reflexes, improved balance recovery capacity, and increased confidence with each step taken. Performing movements safely and effectively. These 4 exercises represent safe, simple, effective movements requiring personalization and careful practice for adults over 60. If beginning exercise after sedentary period, start with short durations using support from chair, wall, or rail for stability. Goal is building functional foundation, not athletic performance. Use caution and consult healthcare provider first if you have recent hip or knee replacements, severe arthritis, vertigo or balance disorders, stroke recovery history, falls history, or neurological conditions. Pain signals require attention, not dismissal. Sharp pain, joint locking, or dizziness indicates need to stop and reassess approach. These movements prove most beneficial when performed daily and gently rather than intensely or rapidly. They function as maintenance exercises, comparable to daily hygiene routines, meant to preserve movement freedom, walking ability, and self-care capacity with grace rather than exhaust or challenge excessively. Safety considerations and precautions. Do not perform these movements without consulting healthcare provider if you have recent joint replacement surgery, severe balance disorders requiring assistance, active vertigo or inner ear conditions, recent stroke or neurological event, unhealed fractures or acute injuries, or severe osteoporosis with high fracture risk. Even for healthy older adults, start conservatively near stable support and progress gradually. Stop immediately if experiencing sharp joint pain, significant dizziness, loss of balance requiring external support, chest pain or breathing difficulty, or severe muscle cramping. Mild muscle fatigue and initial unsteadiness are normal, acute symptoms are not and require medical evaluation. Realistic expectations and timeline. Benefits develop progressively through consistent daily practice. Weeks 1 to 2. Learning proper movement patterns, developing spatial awareness, establishing daily routine, initial balance improvements. Weeks 2 to 4, improved stability during movements, enhanced proprioceptive awareness, reduced balance hesitation, beginning confidence gains. Weeks 4 to 8, clearer functional improvements, noticeable walking stability, better stair navigation, reduced fall anxiety, improved joint mobility. Weeks 8 to 12 and beyond, maintained progressive improvements, established sustainable habit, clear functional benefits supporting independence, continued neurological pathway strengthening. However, inconsistent practice limits benefits, emphasizing importance of daily gentle practice over occasional intensive sessions. Integration into daily routine. These movements integrate easily into daily routine. Ideal timing includes morning before breakfast for gentle awakening, mid-morning as movement break, afternoon for energy restoration, evening before bed for joint mobility maintenance, or combined into single 2-minute focus session. Consistency matters more than perfect timing. Choose times working reliably within your schedule, enabling sustainable daily practice becoming natural routine rather than additional burden requiring motivation. Complementary practices for balance and mobility. These movements work best combined with regular walking, maintaining cardiovascular health, proper footwear providing ankle support and slip resistance, adequate lighting in home reducing trip hazards, vision checks ensuring optimal visual input for balance, strength training when appropriate for additional support, and fall-proofing home environment removing obstacles. Comprehensive approach addresses multiple factors affecting balance, mobility, and fall risk in older adults. Monitoring progress. Track both exercise performance and functional improvements. Exercise metrics: increased single-leg stand duration, improved heel-to-toe walking smoothness, deeper half-squat range without discomfort, fuller ankle rotation circles, reduced need for external support. Functional improvements: enhanced stair navigation confidence, better curb stepping ability, improved walking on uneven surfaces, reduced hesitation during movement, maintained independence in daily activities, decreased fall anxiety. These functional markers indicate meaningful improvements supporting quality of life and sustained independence. Conclusion. These 4 movements provide evidence-based benefits for adults over 60, including enhanced proprioceptive function, improved cerebellar pathway activation, maintained functional leg strength, preserved ankle mobility and reflexes, and reduced fall risk. These practices require no equipment, take only 2 minutes daily, and can be performed safely at home with proper attention to stability and support. Start with one movement using proper form and safety precautions. Practice consistently daily. Progress gradually to all 4 movements. Use support and caution always. Combined with regular activity, proper home safety measures, and comprehensive wellness approach, these movements support continued balance, mobility, and independence throughout aging process. Thank you for watching. For specific concerns about appropriate exercises for your situation, consult healthcare provider or physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on functional movement and fall prevention for older adults, practical guidance prioritizing safety while helping you maintain independence and mobility through simple effective practices inspired by longevity-focused cultures.